Thank you very much. Entire month of May, and invite someone. The doctor will be here. You can ask him questions, and it's free of cost. That's his ministry. Educate, educating others of the benefits of obedience to God's law. And Dr. Clark is no stranger to us here in Macy. We have had him several times, and he has been a tremendous teacher. God has gifted him. And just to let you know, Dr. Clark comes from a lineage of medical educators. Next week, you will hear a little bit more on that in his intro, and you will know that when God has called you, he has called you. Let's support his ministry and let us be blessed as he extends the hand of God through teaching of the health message. At this time, I will hand you over to Dr. Clark, and we welcome everyone from all the various continents that are here, Dr. Clark. So you're speaking to a multicultural group. And glad to have you back. Go
Thank
ahead.
you. Praise the Lord. I'll get my screen share up and going here. There we go. Yes, well, thank you, Don, and it's good to be here with you all. And we praise the Lord that everybody got up on a Sunday morning to think about health. Our topic today is reflux disease, heartburn, indigestion, reflux. Also, this will cover things like hiatal hernia and heartburn. Definitely what we call GERD, gastroesophageal reflux. So is there a cure? That's the question. That was the question that Jeanette had. She went to the doctor with reflux, and well, doctors only have one tool, and that's drugs. So they gave her drugs. She tried one drug. It didn't work. She tried another. And after she tried another, she started getting osteoporosis. You know, these drugs, the reason they have to be prescribed by doctors because they are poison. I mean, literally. And they have side effects. If we didn't call them a drug and think they did some good, we just call them plain poison. But we just say they have side effects. Well, poisons have side effects. They kill you. Well, so she started getting osteoporosis. Well, the doctor sort of had a discussion with her, and he decided that all her hiatal hernia and her gastroesophageal reflux and her indigestion was not in her stomach, but in her head. So then he offered her a tranquilizer pill. At that point, she's like, okay, I'm out of here. This is not going anywhere. I'm not getting any relief, and it's not all in my head. And so she left. Well, we'll tell you what happened with her as we go along here. This reflux disease is growing around the world, and more and more people are getting it. Now, my specialty is lifestyle medicine. I used to practice fairly conventionally, prescribed way too many drugs, I guess you'd say. But now, or since 2006, I've been doing lifestyle medicine. Or maybe I should call it God's medicine. God wants to heal you, not just to put you on some drug company's, payroll, or them paying you paying them. A lot of people pay rent to the drug companies for the last few years of their life, making sure the drug company executives have big incomes and fancy toys and good vacations. And anyway, reflux disease can be reversed, sort of the same way you caused it in the first place. And it can also be helped by natural remedies. So we'll talk about some of these natural remedies. And just to give you an overview, there's a number of areas of the body that are responsible for this problem. Lower esophageal sphincter failure, acid buildup, sources of extra pressure in the stomach. And we'll talk about beneficial lifestyle choices and simple natural remedies that will fix these. Now there's 10 top symptoms of what we call GERD, gastroesophageal reflux disease. And as the name suggests, reflux, it's food coming back up. You sent it down, it didn't stay down, it came back up. And when it comes up with acid. So you get the sour taste in your mouth or acid feeling. And then the third one is bloating. Sort of the idea that the stomach is too full. And we might call this postprandial or after eating fullness. Then there's chest pain. And this gets confused with heart chest pain. And so when you come to the emergency room with chest pain, their first idea is, well, is this the heart or is this some kind of reflux going on? You just feel like when you send food down, it doesn't want to stay down, doesn't want to go down. It just, swallowing obstruction pain. Number 6, burning pain in the stomach area. So that's a little lower than your chest. That's more mid section of your body. And that can be where you feel the pain coming from. Or it can be up in your throat, sore throat. It can be anywhere along the digestive tract there. It can be behind the breastbone, just kind of like immediately behind. And the other things that happen is as you reflux, it affects your vocal cords, and they get irritated, swollen, inflamed, and then you have hoarseness, sore voice box, sore throat, and it can lead to coughing, especially if your reflux turns into aspiration. In other words, the food goes down your airway, your trachea, bronchus, and so forth, down to your lungs. So those are the top 10. And we'll just, think about these top 10. I mean, how many here have had those type of symptoms of some sort or another? You're wondering, what's going on? How do I fix this? And you start reaching for some over-the-counter pill or something. Well, it's very important to figure out why something is happening, because you might be contributing to the problem by what you're taking in the way of supposed helpful nutraceuticals, pharmaceuticals, pills, remedies. And so why is it happening? So let's just kind of really point out anatomically where the causes are. This is sort of the physiology of the problem. And so mechanical and chemical causes of heartburn, indigestion, and reflux. So I'm going to just start here by putting an arrow on where the lower esophageal sphincter is. And it's right there at the end of your esophagus, right before your stomach. And this is the valve that's supposed to keep things from coming back up. You really don't want things to come back up, and so this is the stopping point if it's working. So we'll talk about what makes it not work or be dysfunctional. Then there's too much acid. I mean, the higher the acid, the lower the pH, the more likely it is to cause problems coming up the esophagus if it does reflux. So we'll talk about things that increase the acid or lower the pH. And then there's the too much volume. If the stomach is exploding, it's got to go out somewhere. It has to go down or come up, and it might go both ways. And we'll talk about things that do that. And then there's the other end of the stomach has a valve. And if that valve doesn't open, things can't go out. Or if there's blockages beyond that point, traffic jam if you please, things won't be able to move on. So there you have it, 5 different places at which reflux can be initiated. And we'll talk about why. That's where we're headed here. So let's just start here with this lower esophageal sphincter. And if it doesn't close nice and tight, things can come up. And what kind of things would make it so food comes up? What makes it so this sphincter doesn't tighten up? What makes it so it's weak or flabby or just plain not functional? Maybe paralyzed. Yeah, paralyzed. It's like it's sitting there, but it's not doing its work. Well, I'll put the top one up there, meat, high-fat diets. I mean, full-fat dairy. Something about fat. Maybe it greases the thing so that things slip through. But literally, they do tests. They put what they call a memometer down there, a pressure sensor. And when they put the pressure sensor down there, you eat something fat, uh, meat, fried foods, fat, dairy, then it doesn't tighten up like it should. The memometer says, this thing isn't very strong. It's not pinching down like it should be. And so you get this incompetent, inactive lower esophageal sphincter. The valve isn't holding the food down. It's supposed to be a one-way valve. One-way valve, you go that way, you don't come back. Well, the food's supposed to go down, not come up. But when this thing isn't working because you ate high-fat foods. Well, how do people eat high-fat foods? Well, they buy bottles of oil, they buy animal products, they buy things that are called dressings but are really oil and vinegar. They buy all these oily things, and lo and behold, they get reflux. Or they're eating fried foods, or, lots of stuff. Or what's full-fat dairy? Well, like cheese and cream cheese and cottage cheese and whole milk and so forth. Yeah. Well, and then there's chemicals: coffee, tea, colas, soft drinks, all these things that have caffeine. And the caffeine does several things. We're just talking about the lower esophageal sphincter. It'll show up in these other areas as well. But as far as its effect on the sphincter is it relaxes it. So that's no help. And same with nicotine, pretty similar action. Alcohol, and this is dangerous because the person goes and drinks their alcohol, they get drunk, they fall down, they reflux, then they aspirate what they refluxed, and then they get pneumonia and lung issues, and oh boy, it's a bad cycle. And now there's another thing that's very important to realize, that there's certain chemicals in condiments, such as fermented products. Fermented products, eating something rotten, apple cider vinegar, cheese, sour cream, soy sauce. There's a lot of fermented things. I have a whole talk on fermented stuff. The list goes on and on about things, but when you eat something fermented, it basically stimulates colonic fermentation. And this colonic fermentation then has the ability, through its toxic byproducts, to cause lower esophageal sphincter relaxing incompetency. And so don't eat anything fermented, especially if you have reflux. If you don't have reflux, I think this is kind of an interesting discussion, because they say, well, if you don't have this disease yet, go ahead and eat like a person that's going to get it, and then when you get it, you can decide to try to fix it by stopping eating that stuff. Well, why not just not eat it to begin with and just not ever get the disease? There we go. Now we're talking. Okay, so let's talk about habits that increase the acid. We've now talked about the things that cause incompetent lower esophageal sphincter. Now we're going to talk about things that make for more acid, things that make it, when it does reflux, cause more problems. It's one thing to reflux water. It's another thing to reflux, vinegar. And so if you reflux vinegar, it's going to be much more likely to be acid and burn things. So anything that increases stomach acid, things that, stimulate the stomach to have a lower pH. Oh, we're back to coffee, tea, colas. Anything with caffeine does is caffeine irritates the stomach. It increases the acid. It increases inflammation. It makes it so that you're going to have more symptoms. So leave off the caffeinated beverages. And the next one is fast foods, especially animal protein. Fast foods have lots of salt. Fast foods have lots of oil. Fast foods have lots of animal protein. And the animal protein is hard to digest. Animals who traditionally eat lots of animal protein, like lions, have 10 times as much stomach acid as a human being, suggesting that they were somehow physiologically adapted to eat meat, and us not. Well, right, we're vegetarians. There's other ways of knowing that we're vegetarians by the length of our small intestine. So eating meat takes a lot more acid. So your stomach sits there and makes a lot more acid to unwind the meat fibers. You see, if you look at meat under a microscope, it's got fibers that are all interconnected. Actin and myosin. And when the muscle contracts, they all kind of go like this. When the muscle relaxes, they all kind of go like this. But they're all tightly woven together. How do you digest something that's highly woven together, very tightly woven? Well, you have to have lots of acid to unwind all those little fibers and get to digesting them. So it takes a lot more acid. So you reflux after eating that stuff, you can have a lot more acid reflux and a lot more problems. Another thing that does this is refined sugar, refined carbohydrates. Anything that gives a diabetic a high blood sugar. And when you eat this stuff, you end up making a lot more acid due to the inflammation, due to the nature of this very refined carbohydrate stuff, and you end up with pain. The next one is very spicy things. People say, oh, but I'm taking my cayenne pepper for my whatever. It's not supposed to go down your chute. It's not supposed to go down your mouth. If you want cayenne pepper for a medicine, put it on your skin as a poultice. It'll still get the medicinal properties into you without destroying your digestive tract. And the cayenne pepper, the red pepper, the black pepper, all these hot peppers, they inflame the stomach, they increase acidity, they make it so that you end up with more pain if you do reflux. Now, I want to talk about things that cause acid because they're poor choices of combinations. You know those food combining principles? So mixing fruits and vegetables at the same meal, that's going to cause problems. There's different probiotic bacteria associated with fruits versus vegetables. There's different digestive techniques that have to go into digesting fruits versus vegetables. There's different time courses for digesting fruits versus vegetables. I mean, the combination causes bloating, it causes increased acid, it causes reflux. And I remember when we first learned about this, we were making salads that might look like that. With you have lettuce and onions and parsley, all vegetables, and then you have fruits, peppers and tomatoes and avocados, and you put it all in one dish, and they don't get along, and your stomach cries out, and you're thinking, man, I just don't like salads that well because they always make me feel a little bit like I have indigestion. Well, helps to choose the right things to go in the salad. Either make it a fruit salad like tomatoes, avocados, peppers, cucumbers, or make it a vegetable salad, lettuce, onions, kale, broccoli, whatever. And well, what's a fruit? Well, it has a seed. Well, what's a vegetable? Well, it's what made the plant: a root, stem, leaf, flower. A stem like a celery, leaf like a spinach or lettuce, root like a carrot, flowers a cauliflower, that kind of thing. Well, so interesting. So you're telling me that an avocado doesn't go with my broccoli salad? That's right. Or with my lettuce salad? That's right. How about if I just put slices of orange in with my leafy stuff? Well, it doesn't work. I mean, at least for reflux. It's not particularly helpful. And I mean, if you have reflux, then you know some things to do. All right, salt. You increase the salt, it also increases the acid. All those things that are high in salt: cheeses, tomato products in cans, breakfast cereals, snacks. I mean, all these salty things are going to contribute to the acidity, and you're going to end up with more acid. Another thing that does this is worry, fear, stress. there's always this mind-body connection lurking in the background where if you allow things to destroy your mental outlook, it's also going to destroy your physiological functioning, and you're going to have problems. And stress goes to acid. Acid goes to a inflamed stomach, and sort of contributes to the way you respond to stress. It's a vicious cycle. But anyway, we talked about psychological things a few months back. You can review some of those topics. And then there's medications. Oh, how many medications are really the cause? Yes. And just taking a pill that won't dissolve and sits in your stomach's going to create more acid. But some of those pills have acid producing or stimulating effects by their very chemical nature. And so pills are not the answer. Pills don't cure disease. They just move it around in your body and give you more problems. And oh, I think I'll take an antacid. Isn't an antacid the right answer? And here we have antacid calcium. Well, guess what? Sure, you put something that's very alkali in your stomach. Initially, it brings the pH up a bit, but there's a problem. High levels of free calcium like that actually stimulate acid production. Really? That's crazy. They gave me a pill that would cause acid? Well, I mean, there's no pills that cure anything, and most of the time, yes, the pills create an environment so that you'll buy some other pill or use more of that pill. Some of the high blood pressure pills that people are given by the doctor actually cause high blood pressure. Yes, they have ingredients in there that stimulate high blood pressure. Well, what's going on with the whole, pill industry? They want to make a living, not make you well. Well, that's a whole other topic. I have a whole talk on let the fourth angel sound and drug medications. And okay, let's get off of that topic. Now, if you don't chew your food well, your stomach tries to chew it. How does it try to chew it? Adding more acid. So if you're putting down big particles of stuff that didn't get well chewed, you're in trouble. Your stomach's going to try to take care of that problem, and it can't. Its way of taking care of it just equals more acid and more reflux. So chew your food well. Your teeth are made for chewing, not your stomach. There's no teeth down in your stomach. And so be wise. How well should I chew my food? Well, the more fine the particles that go down, the more your stomach's going to handle it. When I was growing up, there was a newspaper article in Wichita, Kansas, about a lady who was purported to be 135 years old. Now, that's pretty old. And they came to her and they said, "Ma'am, you've lived a long time. Tell us the secret of how you live a long time. What do you think contributed to your longevity? Why have you outlived everybody else?" And her answer was, "Well, I chew my food until I can swish it through my teeth." Very interesting. Good to have teeth at 135 too. Anyway, fascinating. All right, dehydration. If you're not drinking your water, if you're dehydrated, then you end up with more and more concentrated body fluids, some of which are acid, and so the acid goes up. Well, there you go. We've talked about acidity of the stomach and things that contribute to it. And so now you know what to do, you know what to avoid, you know how to approach this. If you're having any of these habits or doing any of these things, you know not to do those. Just makes sense. And so, I mean, how many here can think of some dietary changes they could make to improve their risk of reflux or avoiding it in the future? All right, are you protected? And there's certain things that protect your stomach. And really, the most important is mucosal integrity. What's mucosal? This is the lining of your stomach. Your stomach lining needs to be very strong, intact. It needs to be prepared. It needs to have a thick coating. It's called mucus. And If you do certain things that don't give you good nutrition, then you will not have good mucus. If your meal timing is off, we call it circadian meal timing. If you're always eating at an unpredictable time, the stomach is never going to be prepared with a adequate or more than adequate stomach mucosal lining. It doesn't just put out a heavy mucus all the time. It does it when it knows a meal's coming. And if you are on time, like good people with a watch and a sense of time, then, for example, if you eat breakfast every day at 7 a.m. and you eat lunch every day at 1 p.m., then at 7 a.m., a little before 7 a.m., your stomach will coat with mucus. Be prepared. But if it's unpredictable when you're going to eat your breakfast or your lunch, then it's never prepared. And so you're not protected. And you're sort of causing your own demise. Then there's certain bugs that aren't helpful, H. pylori, and then malnutrition. So now the other thing that is important is a good blood supply. And you have a better blood supply if you follow a clock, if you keep on time. So if you're going to eat breakfast always at 7 a.m., your stomach will start getting more blood to it a little before 7 a.m. in preparation for the meal that it knows it's going to get at a certain time. But if you're never on time, the blood is never on time, and the stomach's never ready, and so you have problems. Okay, so we've talked about how to be protected and what helps protection. Good nutrition, good timing. Yep, those things are especially important. Okay, now, if you have too much pressure in the stomach, it's got to blow out somewhere. It'll go up, it'll go down, it'll go wherever. And so you need to look at this as a problem of overfilling. I mean, we'll talk about things that back stuff up too. But this is overfilling in the stomach. I mean, just eating too much. I mean, just eating too much is going to be part of it. It's kind of like a front loader washing machine. You can only fill it so full, or it's not going to work. If I stuff that front loader washing machine so full that no clothes can bounce around in there, then it's never going to get washed because the clothes are all just a clump going around in a circle in there. They're not rubbing against each other. And I mean, it'd be better to have your washing machine front loader half full to get better washing. So how about if you have your stomach half full? We're told that we often eat twice what we need to. Certain people were told they could eat half what they do. I mean, it's sort of a principle. You don't have to eat till the thing is bulging full. It's not in your best interest. And if you eat till it's bulging full, some of it's going to come up perhaps. Now, another thing that keeps the stomach from emptying so that it's too full is eating between meals. Oh, I know they've given it the fancy name of snacks these days. And they even suggest snacking. Who am I saying that they? Well, people who don't know. People who claim to be experts and yet are not experts. People who really have no clue of how to be healthy. They just know what their grandmother did and thought it was a good idea, so they tell you to do it. Snacking between meals. Eating more than 2 meals a day, or 3, but especially 2. You end up with overfill. So if you eat breakfast and then you eat a snack in the mid-morning, you're going to have food from breakfast that won't be digested until clear at night, because the stomach stops and starts all over again with the digestive process, and you end up with more reflux because that stomach is overfilled. You're stacking your meals. They're accumulating. They're not passing on. It's like, this thing is backing up, and kind of like like a toilet that gets too much stuff in it and backs up. That's a terrible example, but anyway, you get the idea. Quit putting little things in there before the thing has a chance to pass the previous meal on. Now, another thing that's a problem is poor chewing, and I sort of suggested this previously with the same picture. Some people eat too fast. I don't have time to eat, so I'm just going to stuff this stuff down. If you don't have time to eat, eat less, chew it well, and because poor chewing means it's going to sit in the stomach longer. When it sits in the stomach longer, it contributes to the volume of the stomach longer, and you're going to end up with too much pressure down there. Now, here's a thing that really hits some people square on, and that is liquid with meals, liquid right after meals, or just plain liquid meals. The stomach will not just digest stuff if there's too much liquid in it with it, or it's made out of liquid. It has to absorb a certain amount of the liquid first before it'll start digesting what's left. And that takes time, and that takes, it'll make it so that there's a chance of higher volume and more likely to reflux. So no, the liquid with the meals, don't drink with your meals. The liquids right after your meals, don't drink within 2 hours of eating. Liquid meals, soups, porridges, juices, smoothies, those, as we're told, cause poor vitality. This is a problem, and so don't make meals liquids. You're supposed to chew your food and drink your liquids in between meals, and only drink water in between meals, and not make liquids your food. All right, put a knife to your throat if you be a man given to appetite. Well, that's quite a statement. I guess, our wise man Solomon was on to something here. Blessed art thou, O land, when thy king is the son of nobles, and thy princes eat in due season, meaning on time, according to the clock, for strength, to do what they need to do, and not for drunkenness, just because it tastes good. So, how do most people decide how much food to eat? Well, if it tastes good, eat more. I mean, you bring out something that tastes even better, and they'll eat more of that, and you can stuff people clear full just by and tantalizing their taste buds. It's appalling. It's debauchery. Yeah, you just keep eating until you somehow the balance between how full you are and how good it tastes turns off the appetite. How ridiculous is that? I mean, if it tastes good, eat more of it. That's what keeps the fast food restaurants in business. That's what keeps the doctors in business. And all this obesity is just catching up with folks, and just because you ate too much, you ate too much, and this causes problems. So, can you eat too much food? How many here know somebody who overeats? How many here overeat? And so appetite is one of the big rites of passage that you have to overcome to get to heaven, right? Right. You mean appetite stands between me and heaven? Well, I'm just kind of reading between the lines. Eve had an appetite issue. A lot of people in the Bible had appetite issues, and some people overcame. Daniel and Jesus, and right. Paul talks about those whose God is their belly. Now, certain foods and lifestyle practices delay the emptying of the stomach. Can't get food out. If you can't get food out, it's going to come up. Well, what delays the emptying? Well, the way it gets delayed is this. Your stomach can actually count calories. It's an interesting process, and it only lets a predictable amount of calories out each time that the pyloric valve opens, the end of the stomach valve. Excuse me just a minute. And so, if that valve isn't opening like it should be, you won't be getting food out, and it's because your food is too calorically dense. In other words, if you eat what's pictured here, it's very high calorie, and your stomach only lets out 200 calories every time that valve opens, something like this will take, 5, 10 valve openings to get through. And that's going to take a long time because it only lets a little bit through at certain time intervals. It doesn't just keep doing it constantly. It's got to, only send so much down at a time. And so because you ate very high calorie foods and only a certain amount of calories are sent on each time the valve opens, it's going to take a lot longer to get it out. And therefore, it's going to contribute to accumulation and backfilling and probably acid. And, and if it's this type of food, high in fat, high in sugar, it's going to make the lower esophageal sphincter incompetent. Wait a minute, are you telling me that cheesecake's going to cause reflux? Well, yeah. It fits all the criteria. It's part of the problem. Oh, well, what do I eat instead of cheesecake? Oh, go look at our website under recipes. We got something there that's good. That sort of, makes you think it's cheesecake and it's not. All right, cold food, hot food. Well, what's the matter with cold food and hot food? Well, I'm talking very hot and very cold. That's pictured here, but you see, the stomach also doesn't send food on unless it's the right temperature. It doesn't let the digestion start unless it's the right temperature. The food has to be about the right temperature, about the temperature of your body, to be the most easily digested. And if it's very cold, then the body has to warm it up. If it's too hot, it has to let it cool down. And this is a time delay. And a time delay is an emptying delay. And an emptying delay is a chance for things to reflux. And so you need to eat food that's, about the right temperature. Now, I've already mentioned liquids, but I want to go through it again because this is an important one. A lot of medical missionaries think it's time to get out the blender and make a smoothie if you want to make somebody healthy. Where'd that idea come from? Oh, spiritualistic practices in India called Ayurvedic medicine. They claim they have a 5,000-year history of using juices to balance the Vita, something, and Kappa, fire, water, and air in your system. And it's all from spiritualism. But anyway, liquid meals, soups, juices, porridges, drinks, smoothies, all these things are not helpful. A soup is like a swamp in your kitchen put into a pot and heat it up. I got the swamp in my pot. Okay, you're going to eat the swamp, drink the swamp. I mean, it doesn't help minerals and vitamins and nutrients to be there. It just sort of makes everything into a mess. So don't make your foods liquids because your stomach's going to stop, and stopping means delay and emptying. It's going to stop and have to absorb some of that liquid before it can get at the nutrients. And in the process, it sort of mimics leaky gut syndrome. Well, that's a whole other topic, leaky gut. Really, a smoothie is leaky gut in a bottle. You don't want that. It just puts extra work on the kidneys because all that leaky gut stuff that came through so fast hits them, or it gets clogs your brain. You can't think very well. I mean, it's not a part of God's remedies for disease. All right, supplement tablets. And some of these things just never dissolve. And you find them in people's stools and in their sewers. And what happened? Well, the company put something really good in a capsule, but the capsule was almost like plastic and wouldn't dissolve, so you don't get any of it. In some cases, that might be better because the stuff in the capsule might hurt you. But anyway, these large objects that aren't obviously chewed, you don't chew a capsule, make it so that you're going to have troubles because your stomach's going to think it can break it down with acid or hold it there for a long time while it tries, and you're going to get a delayed emptying. All right, another thing that delays emptying is the later in the day you eat your meal, the longer it takes to digest. The later in the day you eat your meal, the more likely it is to cause reflux. The later in the day you eat your meal, the closer to bedtime, the longer it takes to digest. And if it takes longer, that means it's going to delay emptying. If you eat a meal, let's say You have a meal of granola, a banana, and some soy milk. If you eat it in the morning, it'll digest quickly. You eat it at night, it'll take twice as long to digest. If you eat it at night and then lay down, it'll take 3 times as long to digest. And so taking longer to digest means it's going to be in your stomach longer, means it's going to be delayed emptying, means it's going to be more likely to have reflux. And people go lay down after they've eaten. You shouldn't eat within 3 hours of going to bed. And you shouldn't eat anything but fruit for supper. No vegetables. No high-fat foods. If you're going to eat a supper, it should be just fruit and maybe some bread-type products, but certainly nothing that takes a long time to digest. And otherwise, you're going to have reflux. Now, another thing that will cause delayed emptying is psychological stress. We already talked about psychological stress under more acid. Now you have more acid and delayed emptying. So, you ever feel upset and your stomach, we're told if we're all upset we shouldn't eat. Better to skip eating than to eat when you're upset. Yeah, it makes a difference. So if you are stressed, eating less is good. In fact, fasting and eating less can actually help psychological symptoms. So there's benefits there. Okay, so that was our whole section on delayed emptying. Delayed emptying causing disease, which we call reflux. Now we got to talk about things that cause traffic jam below the stomach. So that even if the stomach valve opens, there's no place for the stuff to go. Anything that creates a back pressure from below the stomach. This is what we're talking about now. Below stomach back pressure. Anything low in fiber and high in fat. Refined foods, meats, anything that causes constipation, like cheese, anything low in fiber is going to contribute to this. There's no fiber in dairy products. Dairy products are liquids, and then maybe they coagulate through whatever process to yogurt or cheese. But they don't have fiber. Because they don't have fiber, they aren't going to move through the intestines well. And because they have case morphins, morphine-like substances in them, morphine causes constipation. They cause constipation. And this will make it so that your transit time goes up, longer time to get out. And interestingly enough, people who eat high fiber have a bowel movement about every day. They send their entire food through in one day. People who don't eat much fiber, it takes 3 days, 3 times as long. I mean, that's 3 days, three whole, and it's just an amazing problem. And juice, they remove all the fiber, so that's not a great option. Another thing that will affect this is a tight belt, tight clothing. Notice the lady's pulling on her belt string there. And a tight belt is going to make it so that your transit time is increased. It increases the temperature of your intestines. That's part of that colonic fermentation and causing lowered esophageal sphincter incompetency. Lots and lots of tight things around your body create blood flow restrictions. If you restrict the blood flow in the surface by a tight belt, it in turn restricts the blood flow in the intestines. Poor blood flow spells slow activity, spells overgrowth of bacteria, spells increased temperatures. All this kind of thing is going to cause a signal back to the stomach, we're not ready for more food, don't send it down, you're going to be in trouble. Another thing that's not helpful is sedentary lifestyle. Have you heard that we should take a walk after every meal? We'll get to that here when we get to cures, but people who just eat and then go lay down, people who eat and go sit on the couch and watch TV, people who eat and don't do any activity to justify having eaten that many calories, end up with stuff accumulating in their intestines. or poor posture. I mean, all three of these people don't have real great posture on their couch. And yeah. Another thing that slows the intestines is depression. Well, or was it the slowed intestines that caused the depression? It goes both ways. Which came first? I don't know. But anyway, we're working at it from the point of view of reflux. So if you're depressed psychologically, then it's time to psychologically tune up. And one of the things that helps is, exercise. So there's benefits there to activity and exercise. So, do you ever feel bloated? What changes could you make to avoid that problem that you've learned so far? Now, some foods and lifestyle factors increase reflux, dyspepsia, heartburn, hiatal hernia. What's hiatal hernia? Well, that's when the top of the stomach keeps trying to push its way up through your diaphragm. And it's all part of this whole constellation of symptoms we refer to as GERD. Now, things that will cause increased GERD include tomatoes, citrus, nutritional yeast. There's just some of the top ones that have been identified. Again, this is without any worked out or published mechanism, although we could sort of speculate as to why and what. Meat products and eggs definitely are always the top of the list, even though they haven't always worked out a mechanism, although I have given you several mechanisms so far. Cheese, and I would suggest it's because it's an inflammatory product. It's all rotted, fermented, spoiled, aged. It's got oxidized lipids or peroxidized lipids, rancid lipids, rancid fats. It's high in fat. I mean, there's all kinds of things about cheese. I mean, aren't we sort of told cheese isn't food? Yeah. And then there's vinegar. I mean, it's sort of obvious. This stuff is acid. So if you have an acid problem, why would you take acid? But you can fool people. You can talk people into this. How many people do you know that have talked themselves into taking vinegar to fix reflux? Why did they give Jesus vinegar? Because they thought it would deaden his nerves. Oh. So really you take this vinegar stuff, it tells you there's no reflux because it deadened the nerves, not because it fixed anything. It actually made the problem worse. And so it's sitting there pickling your esophagus rather than letting you realize you're getting destroyed from the inside out. Okay, there's certain deficiencies, magnesium and vitamin C. Now, I'm not suggesting you should be using lemon if you have reflux. Actually, that would sort of be contraindicated because, as much as lemon is good for you, if you're having an acid stomach, you probably don't want more acid of any source. And pumpkin seeds are a good source of magnesium, but Now, if you have too much weight on your belly, too much packing over your stomach, too big of a load laying on your stomach, you're going to get reflux. That's just a physiological fact that, if I came and sat on your stomach, where do you think the food would go? Or if you have 100 pounds sitting on your stomach in the form of a spare tire, we call it a spare tire, a belly fat, then you're going to end up pushing things up or around or down or whatever. Now, how you breathe makes a difference. You're supposed to be breathing with your diaphragm up and down, up and down. But if you're breathing from your shoulders, then you're going to have more problems. It's not going to work out correctly. Okay, so those are things that are causing reflux from an interesting standpoint that aren't always clear why, but epidemiological studies declare it to be so, but we've come up with some mechanisms we suggested here anyway. Now, if you keep on burning your esophagus, it increases your risk of cancer. Really, cancer in some cases can just be over energetic healing of wounds, healing of inflammation, healing of insults. And that's what's happening here with reflux. We call it a Barrett's esophagus after the person who described it. Barrett's esophagus is a esophagus that keeps getting burned and keeps trying to heal. And after a while, it decides just to heal because it's just going to get burned again. And when it heals without any reference to how badly it's hurt, and it heals when it doesn't need to, it becomes cancer, overgrowth of healing. What are the risks associated with Barrett's esophagus? Well, if you're not eating enough fresh fruits and vegetables, you don't have the nutrition to heal the thing. If you're eating a lot of processed food, you don't have the nutrition to heal it. If you're eating a lot of food that has no nutrition, such as meat and dairy, or very little nutrition, then you don't have the nutrients you need to heal it, so you're in trouble. You need more fresh fruits and vegetables. If you're eating a diet that's rich in cereals to neglect the fruits and vegetables, some people quit eating meat and they become grainitarians. Some people quit eating meat and they merely adopt a meat-avoidant diet. They don't think about what they're doing. They don't eat necessarily good food. They just don't eat the bad food. That's not the answer. You need to eat good food. Fresh fruits and vegetables sort of top the list. Some people are deficient in vitamins, therefore, because they need the fresh fruits and vegetables to have vitamin A and vitamin C. Vitamin A from the orange vegetables, and vitamin C from red cabbage and citrus and peppers and so forth. Selenium like from Brazil nuts. If they're low in these things, if they don't have this kind of nutrition, they don't heal the esophagus well, and they end up with problems. Meat and high animal fat intake is definitely increasing Barrett's esophagus, especially processed meat, salami, hot dogs, bologna, that kind of thing. Smoking, obesity, high sugar intake, inflammatory diet, pizza. Believe it or not, pizza has been identified as a huge cause of Barrett's esophagus. And wearing a belt. These are studies. This all represents studies that looked into this. Okay. Now, how many here are beginning to see that reflux can be treated with lifestyle changes alone? The people cause what they get, and they could stop it by changing the causes.
You're taking out of bed with the daddy?
And so we're looking at ways of fixing this. If you are suffering with GERD, here's a number of natural remedies that you may find beneficial. These are some of our things to work on. So this is like preventatives, okay, or lifestyle changes. Then we'll get into treatments after that, okay? So first, preventatives. Eat high fiber fresh fruits and vegetables. Lots of good fresh fruits and vegetables with lots of fiber. This helps keep transit time going. This gives you nutrition for healing things. It gives you antioxidants for fighting inflammation. This is your source of good food. You want to live good, you want to be healthy, eat good, healthy food. Eat mainly low-fat, low-calorie foods. Don't overeat. Maintain regularity in your meal schedule. Eat at the exact same time every day. What if I can't eat at the exact same time every day? What do? Skip. Skip. I'll be skipping a lot. No problem. Fasting is good for these kind of things. And most people eat twice what they regularly should. So you get a schedule that fits the majority of times that you can make the schedule. And then when you can't make the schedule, you skip rather than changing your meal times. Leave at least 5 hours between your meals. In other words, if I finish breakfast at 7:30, I better wait 5 hours before I eat a lunch. So schedule your lunch to have 5 hours in between. Some people do this. They eat breakfast at whatever time they feel like it, and then they wait 5 hours before they eat lunch. Well, I suppose that's a step better than just randomly eating either one, but the idea is to have a schedule for both, not just put 5 hours between random meals. Excuse me. So if I eat my breakfast at, let's just go through a little timing discussion here, because it's good to understand how this timing works. Let's talk about the principles. have at least 5 hours between meals, have at least 3 hours between the end of supper and going to bed, and have a regular bedtime. Okay, so how does that all fit together with trying to put in, for example, if I was trying to eat 3 meals a day? If I'm trying to eat 3 meals a day, and I want to get to bed at a good time. Let's say I go to bed, my bedtime is 9 o'clock, okay? Just for argument's sake, okay? Actually, let's make it 9:30, because we're going to have a hard time getting this in. Okay, if my bedtime is at 9:30, then I should finish my supper by 6:30. 6:30, 7:30, 8:30, 9:30. So I better not eat later than 6 o'clock if I'm going to go to bed at 9:30, because I need 3 hours between. And I should only eat fruit for supper anyway. But anyway, so here we have a supper at 6. Well, if my supper is at 6, then 5 hours before that's got to be the end of my lunch. And so if I'm starting supper at 6, 5, 4, 3, 2, 1. Well, I better finish eating my lunch by 1, so I better eat at 12:30, I guess, if I haven't having a half hour for lunch. So if I'm eating at 12:30, when will I have to eat breakfast? Well, let's count backwards. 12:30, 11:30, 10:30, 9:30, 8:30, 7:30. So 7:30 should be the end of my breakfast, so I better eat at 7. So 7, 12:30, and 6 would have to be my meals if I'm going to get in 3 meals a day with a minimum clearance of 5 hours between meals. I mean, our counsel is 5 to 6 hours. So it's hard to get 3 meals in and do it efficiently and fit. Yeah, it's very hard. So 2 meals is actually a much better plan. So eat only 2 meals a day, skip supper, don't snack. If you do eat supper, eat only fresh fruit. Don't eat within 3 hours of going to bed. Take small bites and chew them very well. Take a short walk immediately after meals. This keeps food from coming up, helps jiggle it down, if you please. Don't make or eat liquid meals, soups, smoothies, porridges, juices. Drink 8 to 10 glasses of water a day, taken at least 30 minutes before meals. In other words, don't drink anything within 30 minutes of eating. And 2 hours after meals. In other words, don't drink anything until your meal's been digesting for 2 hours. After meals, after the end of the meal. Wear warm clothes with no tight bands around the waist. Warm clothes meaning, this lady doesn't, pictured here, doesn't qualify because she's got bare legs. She needs to have something on her legs that equals the amount of clothing on her trunk and arms. Otherwise, you end up with blood congestion in your trunk and it slows digestion. Alright, if you are currently in pain and looking for relief, oh, this just hurts, what do I do now? And you want to heal it, the following remedies could be helpful. Charcoal capsules, charcoal tablets, charcoal powder. My first choice would be charcoal powder. And how much shall I take? Well, it depends on how bad it hurts, how long you've been having this. And if I got serious indigestion, I didn't even mention food poisoning, did I? Food poisoning can cause bad reflux. So if I think I've got food poisoning or I got bad meal or something, I did this a couple days ago. Take a cup of water, put it in a jar. Should be cool water. Why cool? So it doesn't go through your system too fast. You want it to do its work. Cool water. I put in a tablespoon of charcoal powder. That's a big tablespoon. Then I put in a teaspoon and a half of psyllium husk powder, fiber source, so this charcoal doesn't cause me constipation, which it does, but that fixes it. So I put it in the water, put the lid on the jar, shake it up, and let it sit for 10 minutes. Why 10 minutes? Well, you have to get the charcoal wetted. What's wetted? It has to have a water bond between its surface. Charcoal is a bit hydrophobic, meaning it's slow to wet, slow to, you know how it sort of sits on the top and floats around and doesn't just get wet immediately? I mean, if you put in a piece of paper towel, it would get wet immediately. but you put in charcoal, it floats around. You have to let it get wetted so it has a stronger drawing power when it gets in your system to pull out inflammation. Okay, so I let it sit for 10 minutes, then I shake it up again, and I drink it down. Don't have to guzzle it, just drink it down. And that's a way of treating peptic ulcers, Barrett's esophagus, inflammation, a toxic insult from food poisoning, toxic result from taking drug medication, whatever. That said, if you need your medication for some other reason, taking charcoal won't help you because it'll absorb that medication you need and you won't get any of that medication. So don't do this within 2 hours of taking a medication your life depends on. Fruits, beans, vegetables are helpful because they're high in nutrients, high in fiber, especially the beans. Beans are, this is fairly simply prepared beans, not highly seasoned with any of the dangerous things that we might have mentioned earlier. Pears, bananas, cucumber, kiwi are all known to soothe the digestive tract. Cabbage and its juice. I'm not big on juicing, but cabbage for sure. And but sometimes perhaps medicinally some cabbage juice might be in order. But cabbage for sure, and it has good probiotic, it has good soothing properties, it has good healing properties. And carrots, kale, and radish also are good for the digestive tract in healing and soothing pain and inflammation. So we're talking about what to do remedies-wise, what to eat for a meal that helps. Broccoli sprouts help to fight H. pylori. You're having H. pylori problems, I told you have to take antibiotics and blah, blah, blah. Take broccoli sprouts. Aloe vera juice, very soothing juice, or some people just chop up their aloe vera plant and get the jelly out of it. Carob is soothing. It's also good for other digestive issues like diarrhea. Dandelion tea. Fresh comfrey is sort of a universal healing herb. Alright, now let's talk about a schedule of the day. And I sort of did this already, but I'm just going to go over it. So if you got up at 5 a.m., you could drink a lot of water, like a quart of water, and take a walk outdoors. This will get your digestive tract well hydrated. Remember we said dehydration was a problem? Well hydrated, so get up at 5, 6:30, drink 1 cup of dandelion or comfrey tea. So we're putting your medicinal tea into the program. 7 a.m., eat a breakfast, mostly fresh fruits, bananas, pears, kiwis, fresh fruit, any kind. After breakfast, take a 15-minute walk outdoors. This is your digestive walk. 10 a.m., drink another quart of water with 1 teaspoon of activated charcoal in it. And when you put this activated charcoal in it, I'm just putting a little bit here. This will soothe your digestive tract. Take a short walk then, too, if you're not doing anything else, or if it's break time or something. Activity is very important. Remember, we said inactivity is a problem, so we're giving you activity. 12:30, drink another cup of dandelion tea or comfrey tea. 1 o'clock, eat lunch. Eat at the exact same time every day. Concentrate on good vegetables, raw, steamed, less unprepared or complex foods. Avoid mixing fruits and vegetables at the same meal. Chew your food well. Don't overeat. You can look at our website for some recipes if you like. After lunch, take a 15-minute walk. Drink 1 quart of water. No need to rush. Take a short walk if possible at that time. 6 o'clock, it would be best to skip supper. If you can't, eat only fresh fruit and chew it very well and take a walk afterwards. 9 o'clock bedtime. So there you go. Now, let's get back to Jeanette. They gave her multiple drugs. They gave her osteoporosis. Then they said it's all in her head. Well, that's no cure. That's sort of insulting. Tell your patient they're a head case. Anyway, so she switched to a plant-based diet, high in fiber, complex carbohydrates, and it was wonderful. She said she felt completely and blissfully well. The reflux was gone. And so she was blessed. So if you go to our website here, Northern Lights Health Education, you look over here on the left-hand side, you see a button here called Presentation Handouts. If you go to that button, you'll see a handout there for indigestion, reflux, GERD, and you can download it and print it out or read it online if you want to review. Or if you go down here to online videos, you'll see we've done this before, and other, or our YouTube channel will show up if you want to review. Or you should be able to get a link here from what's being broadcast today. All right, so heartburn, indigestion, reflux, is there a cure? And we're saying yes. Don't do the things that cause it. Do some simple natural remedies to fix it, and then enjoy better health. All right, so I'm going to undo my screen share and go back here so we can take questions.
Thank you very much, Dr. Clark. What we will do, I'll ask you to tell us what's coming up next week, and then we will end the live stream here.
All right, are we talking about Alzheimer's next week? Let me just get my list in front of me here, and I'll tell you. And so next week we are talking about Alzheimer's, keeping your mind sharp. Alzheimer's is increasing at an alarming rate. Doesn't bother the people that get it, but it certainly bothers their caretakers. It's one of the biggest sources of stress, is being a caretaker of Alzheimer's patients. And so as much as you want to save your brain for yourself, you also want to save your brain for your loved ones. And so we talk about what causes Alzheimer's, what lifestyle factors contribute to it, and then simple things to help keep your brain sharp, how to keep your brain working, how to keep from getting Alzheimer's, and a few simple natural remedies for actually treating people with Alzheimer's. So there you go. This is and I hope everybody remembers to come to that one.
Yes, yes, I do hope so too. We can fall into that category at some time, so um, let's be prepared. I will end the live stream now, and those of you who are in Zoom remain, and we will continue with our Q&A.